Perfect. I have Linda Gallus here with me today, and Linda is helping me. She's going to be driving the information on the screen. Makes it a little easier. So if I keep looking over, I'm looking at her. Linda is our wellness coordinator, and I want to thank her for helping me today. So welcome again. The Safety, Health, and Wellness Committee of the Chamber is pleased to bring you Session 2 of our 6-part series of best practices during COVID. With things changing at a rapid pace, we value the cooperation within our members who are willing to share this information that they have available for the health and safety of our community. Last week, we had the opportunity to have an update from the Manitowoc County Health Department. All the webinars will be available to view on the Chamber's Facebook page and on their website. So again, my name is Kristin Jacques. I'm with Bellin Health, and what I'm going to do today is to walk through a website, and we have at the end, we have a really awesome Mythbuster video from Dr. Burmeister regarding COVID-19 and what he sees in the emergency room. And what we also want to do is spend the first part of this presentation talking about the tools and the resources that are available for you as a business owner, as a community member, to help keep your business open and to remain safe. So before we get started, just a reminder, if you could please make sure your phones are muted, that would be great. Thank you. So we do have our resource. So Linda, we had the page that has the tools on it, the website. I just wanted to share that. So we have many different resources for you, as you can see on the page right now. We have our web page, which is bellin.org, Employer COVID, which is what we are going to go through in some greater detail throughout this webinar. We also have our 24/7 COVID hotline. You can see it here as well. And then we also have our COVID email. So without further ado, we're going to hop right into our bellin.org Employer COVID page. And please feel free to take notes. What I wanted to do is just let you know that this page is available to all of you. Everything on here is no charge. There's downloadable, printable information on here that you are free to use and access any point that you may need. So please take the time to go through this and really take a look and see what you can be using. We're going to go through it, and we're going to start out, and I'm going to look down at my notes every once in a while, so I apologize for that. But as we go through, we wanted to help to make sure that we partner with our employers and our community members to help businesses stay open and people to stay safe. So knowing that this is changing on a daily basis, the information that you're going to see in here may be one way today and could be changed tomorrow, but we keep it very fluid and very up to date. So what I'm going to do is just walk you through this website real quickly. Take notes, but on the bottom of this page, I just want to point out, and on the bottom of all of the pages, you can see there's a contact us. Again, my name is Kristin Jacques. My phone number is on there. My email is kristin.jakes@bellin.org. Please feel free to reach out to me at any point if you have any questions. But what I really want to point out here is you all have an opportunity to ask an expert. And if you could please mute your phone, that would be helpful. We're getting some background. Thank you. So click here to ask the expert. No question is too big or too small. So if you have a question for our experts regarding your business, a question on testing, masking, etc., it doesn't matter. Please click here, go to the email, ask our expert, and what we will do is we will secure that answer for you and get back to you. Our preferred time preference would be 24 hours, but if we need to go to a physician, it may take 48 hours in order to get that physician's answer. But just wanted to let you know all of you have this great resource to be able to ask an expert. So we're going to look back up to the top of this page, and we're going to go through some of the information that we have available. Again, our local COVID-19 education and information, I'm not going to really go into depth in any of that because it's all information that you have either seen already. It's our current stats, it's our signs and symptoms. It's a lot of the information that we saw at the very early start of COVID back in the February, March, April time period. What I'd like to focus on and just share with you, we have some individuals who really like data and may wonder how we are doing as a society, community, maybe as Manitowoc County or our Northeast Wisconsin regarding trends. So what I wanted to do is I wanted to ask Linda to click on our first one, which is the Department of Health Services. And this site is actually very helpful because it really talks about Wisconsin and how we're doing. And you can go down. We're going to scroll down. I'm going to go through these relatively quickly just to keep an interest, but you can see that we can view the COVID map. But this here is where we get our Wisconsin COVID-19 summary stats. So if somebody's actually wondering how many people have been tested in Wisconsin, we can see we're over 1.3 million. We have the confirmed cases of how many positives we have and how many negatives we have. And we also have the confirmed case information, and this is kept up daily. As you can see, this information was updated as of yesterday. We have a recovery status. Recovery status is important because it does show, how fast and what percentage of people are recovering versus having further issues or signs and symptoms. We have deaths. Obviously, we track the death number in Wisconsin. We're over 1,100. And then the hospitalizations, and we'll get into that a little bit more based on your region. So we've got the hospitalizations. So that's just a really quick reference. You can go down, there's a lot of information, number of newly COVID cases by day and the 7-day average. So this is just information for those of you who want to peel into this a little deeper. Please take note of this site. We're going to go to the next site, but this gives you a lot of good information on Wisconsin. So that's all in the website as well. So as we're maneuvering back, you can see the local COVID, just under the infection rates. You can see we do the same thing for Michigan. So we also track the Michigan, as Bellin Health has locations in Michigan. But what I do want to point you to is the last website there. It's the WHA, which is going to be the Wisconsin Hospital Association. This right here, this is developed by the Wisconsin Hospital Association, the WHAIC, in collaboration with the Department of Health Services. And this is a dashboard of ongoing enhancement. What's nice about this is we can really drill this down, and we can see by Wisconsin and by region. So this is by Wisconsin. You can see there are 133 total hospitals in Wisconsin. Our hospital admissions to date are 297. You can see 88 patients currently are in ICU. So this is just our current, and the bottom left under the map, it gives us the total number of cases, again, the negatives and the deaths. But what's nice about this is if you go up to where the map is, you can pick your region. So we're going to go in and we're going to hone in, and we're going to hone in on the Northeast region because Manitowoc County falls in the Northeast region. So when we hover over each of these counties, we can see that we have Brown County, we have Manitowoc County, we have Kewaunee, but let's go to Manitowoc. We have 7.9 cases per 1,000 of people in Manitowoc County. So the stats that are represented on here from the total of our 10 hospitals in this Northeast Wisconsin region, you can see currently today, or as of yesterday, there are 34 patients in the 10 hospitals represented here that are COVID-19, and we have 7 individuals who are in ICU. And if we scroll down underneath the map, we can see that for this region, we have our total tests that are positive, negative, and then the total deaths as well. What's nice about this page is when we scroll down, it gives us a little bit more information on the positives identified per day and the hospitalizations per day. And then one more, we can go down the percent of positive tests per day, and then we get into ventilators and ventilated patients. So there's a lot of information in here. So the purpose of just showing this to you is just letting you know that in one very easy location, you can grab any of this information if you need. There are times where employees are asking how things are going, leaders are asking, or we as the community members are curious and wondering, what the stats look like. So as we go back to the page, we're going to take a look at, if we scroll down just a little bit, we've gone through the trends. And the balance of the information, we have local testing. So as a reminder, if there's any inquiries about testing, just wanted to pull this up. This is where somebody could go on if they really wanted to further pursue a COVID test. If you're a new user, we can activate an account, but this gives you some information just even before you get to scheduling your test, but it helps to find out, just some information. And we have our COVID hotline if you just have a question. Please feel free to use all these free resources because they are out there for you to help make your business run smoothly, safely, and keep yourselves healthy. So we're going to move on to the next section within this site, which we're going to get into a little bit more detail. We're going to go to the employer COVID update. And the employer COVID update, as soon as it moves, there we go, is Bellin Health hosts an employer town hall on a monthly basis. We've done about 18 of those town halls to date. We invite any of you to please join. You can see on the very top here where the mouse is. If you're interested, we have our CEO give some of the updates from the site that we just showed you. We have employers who talk about some of their safe return to work. We've got providers who are talking about current situations with COVID. So we do a lot of discussions. And if you are interested in having an invite or getting invited, please click here. It'll be a Survey Monkey. Please fill it out. Our next town hall is next Tuesday, and we are going to be talking about how we as Bellin Health, with our 4,800 employees, are working with our employees due to the school situation and being flexible, knowing there's some individuals who are home helping their kids. The Green Bay School District chose to go all virtual. That's a very large area for us and many of our employees. So we are going to talk next week, Tuesday at 1 o'clock, about how we, Bellin, are going to assist those employees with flexibility. So that is our pretty much our update. You can also go on our employer town hall on demand. You can see where the cursor is. If Linda points right to it, right above the employer 19, we have our last town hall call that has been recorded. And that was with Damien he's the superintendent of the Howard Suamico School District. So if there's any schools on the line, he was great talking about returning to work, returning to school, and how they're making it safe for their employees and their students. So that's all recorded. Please feel free. That's about an hour long. You can skirt through it, but feel free to access that as well. And again, our contact information. The next tab, the next page, is going to be some really important stuff. So this is probably where we spend the majority of our time. With the pandemic quickly escalating, we are learning that continuous communication is truly important, and we like to be transparent in assisting anybody with any of the information and acknowledging that, this may be our new normal. So below are some tools. Again, the COVID-19 testing, we already looked at that. That's the local testing. You can see that we offer our Bellin Health system links in both English and Spanish. So what you're going to find in this site is we offer multiple languages, which is truly an important feature. So if we click on the English online resources and health system services, we are going to see that this is the Bellin Health. We are showing you, we're opening our door and showing you what we have available to us and what Bellin offers. So these are quick links on how we can get tested, some other information, but it's also about, we go up into some of the tabs down below, are right there, COVID-19 patient instructions, what about my COVID-19 health needs, community resources. So we have this here available for you, but again, this is our Bellin page, our resource page for you to please feel free and go on there anytime and pull any of these resources. If we scroll down on that page, we can see that there's many different information. We have the testing sites. We do have some other information. And then, we have questions like, what's the difference between viral testing and antibody testing? So we have information on that. So there's just a lot of good information. Don't sell this site short by not scrolling down. Please scroll down. We have safety and hygiene. We have, a lot of questions. And then we get into the cases by county. So please feel free to use this. And we've probably seen that on many of the TV shows. What is COVID-19? So please use this site as needed. So we can go back to our prior page. So we have that both in English and in Spanish. Mythbusters by Dr. Burmeister. We'll be getting to that shortly. We have CDC Poster Resources. What's really neat about this is you can use this. Please feel free, but we're going to click on the CDC multiple languages. So these are posters that the CDC offers, again, all in one spot. If we scroll down, there's multiple. There's K through 12, how to protect yourself. I think there's like 94 posters total. But the really cool part about this site is it gives you your audience and it gives you the different languages. But if you're like, well, Kristin, I don't want to have to scroll through 95 different posters to find out what's all available by a certain language or by my location or my business, this site actually offers, if we go to the top, we can see that we can search by, and you can put a language in there. For instance, you put Spanish, and we can filter by audience as well. So if you are business, if you're college, community, first responder, healthcare facility, you can click whichever. And then if you do, we're just going to grab maybe, I don't know, we're just going to grab, there's 30 found that are in Spanish with home. So there's spread the germs, 10 things to manage COVID-19 symptoms at home. So you can pull up this poster, and that is English, and we also have that in Spanish. So just a reference, it's again, we didn't reinvent the wheel. We just pulled a lot of CDC information, but what is helpful is that we're putting it all in one location. So if we go back, Linda, that would be awesome. So we have the printed by language. The other thing we wanted to do is the importance of wearing a mask poster. We get that a lot. Really, how important is it to wear a mask? Why should I be wearing a mask? Is it really a myth to wear a mask? Well, we at Bellin are required to wear a mask. I am secluded right now. So Linda is actually through a door in another room. So what I'm doing is sharing with you a poster that you can put up at your home, your place of business, whatever you might feel, but it talks about distancing and then masks. So again, there's a lot of posters here. Sometimes it's a struggle to go to the CDC website itself and search for all this, so we've made it very easy for you. If we go back, we have other posters. You can see the importance of wearing a mask, but we also have symptoms and hotlines. So we've all seen them. We're going to pull up the English symptom and hotline poster. You've probably seen this, and if not, please feel free to print this, post this, laminate it, whatever you need to do. But it's here. We've all seen something similar, but where some locations would fall short, we here in our region, our Northeast Wisconsin region, have a very diverse workforce and community, and we thought it would be best, so we went back and we created this same poster in the following different languages that are listed on there. We have them in English, Arabic, French, Hmong, and just pull up the Spanish one with that. So we have this in Spanish as well, but it comes in all the different languages. So if it's something you can use, please feel free to print and use. Now, mental health moments. So we know that we have heard, and we're all maybe seeing it, mental health has become a very hot topic during this COVID because of some of our social determinants of loneliness, isolation. We were quarantining. We've seen the need and the request and ask for mental health, inquiring social resources, tools. We've seen a huge increase on that. So what we have done is we have created some videos, and Linda Gallick, our wellness coordinator, along with Charles Latour, who is one of our behavior therapists, have created videos. And when you're under the mental health moment, those first, like the tips that build resiliency, etc., those are like 2-minute little videos. But when you click on if you could go back, Linda, we'll show them again, where to click. There's right here for monthly recording sessions, click here, and that's going to take you to our free WellBeing series, and we have them on demand and they're recorded. So they're about 45 minutes in length. They're probably good lunch listening, or even some organizations have pulled together and they have asked individuals, they had a meeting and they had them all stay at their desk or at home and listen to these. These are dynamic. Charles is awesome. He likes to share his trends that he's seeing with the community members. We're seeing, we're answering questions that people have. What about mental health? So he does a great job, not to mention very calming. He has a lot of great ideas and gives a lot of expert advice on how to make it through some of these difficult times. So I invite you to please, go ahead and listen to those recorded sessions as needed. So that takes you to our Lifesaver Wellbeing series, and then there's a lot of information on here that you can use as well. But for purposes of today, we're going to hop back to the COVID employer website. So we went to the mental health moment. If we go down, we have some other videos that are available. Personal hygiene videos in both English and Spanish. So we have gloves with Dr. Mead, cloth mask. We had Dr. Mead go ahead and make some videos for us, and we also have those videos in Spanish. Again, ask the expert, no question too big or too small. Please feel free to send anything you have, any questions you have in. We get testing questions. We get questions about, help me understand why an antibody test may be beneficial, etc. So please, whatever you might be thinking. Now, next we're going to slide over to the workplace COVID policies. So the workplace COVID policies, really what we have done is we have some policies and procedures that we are going to share with you. They are our Bellin policy procedures. So if you're looking to develop them but don't want to start recreating the wheel, you don't need to. You just don't have the energy or the time to really research this, but you know you just have that. It's that nagging thing on the bottom of your to-do list that you keep putting to the next page and the next page. If you need to create a policy on anything, please feel free to use ours. Bellin masking memo. So if we go to that, it's just a memo we put together to explain to our employees why masking is important and why Bellin is requiring masking. And we have a cloth mask. I'm not going to read this to you, but just you can use this as a template. And it just kind of talks a little bit about our expectations of masking. So if we go back, another template that's hugely important is our exposure and our return policy. Many employers say, well, when is it safe to return? When should we return? So here is just our outline of returning. There are different, many employers have different ways of returning. I'm going to asterisk this and say that prior to putting out any sort of policies, you may want to check with any legal team that you are working with. We have with ours, so ours is here. And of course, being a healthcare system, we have a very extensive return. I think, to be honest, right now, some of our employees can be out up to 22 days, depending on the family situation, depending on their test. Even if they test negative, there's somebody at home who may have tested positive. They have to wait through that quarantine, and then they need to quarantine. So we have individuals who can be out for 22 days. So one can imagine if you had some of your staff members out for that extended period of time, how that can affect, your work. Perfect. So what we have here is we have a logarithm. Again, I'm not going to go through it, but it's anyone who created or has a symptom or was exposed. So here's our logarithm for if they've, if they're symptomatic or non-symptomatic. And again, this is our policy. You can read this at your own leisure. But please feel free to use our Bellin policies and create your own from them. A lot here. So then we have coexisting with COVID, back to school. So we have information on back to school, the employee prep. So we'll just click on one of them, and the Bellin Leader Flex options for work. Excuse me. This is our flex options for work. As you know, there's a lot of flexibility being needed just due to current situations, especially with schools. So this is our flex option. And again, on our town hall next Tuesday at 1 o'clock, if you go to the very first page and click on that invite, we can set you up. And I think the chamber also sends those out as well. But we're going to be talking about some of our options. But again, here's our policy for options for work. Please feel free to use those as needed. All right. We are going to go back again asking the experts, and I believe we have one more tab we're going to work through, which is our workplace services and support. So here's a to-do if you're interested. We have done many return to work and readiness assessments for employers. You may be back in business. You may have been shut down for a while or quarantined, but now you're back working with the public. So what's really nice about this assessment is we have a business safety assessment to help you determine if you're ready to go to the next step, or if there's any things that need to be done. We're going to scroll all the way to the bottom because I want to explain that this is done on a point system. So you will take this assessment. If you would like us to assist you with this assessment, please feel free to reach out to me on the bottom of the page. But if you give yourself points, a 1 point, a 0.5, etc. So you go through that entire assessment and you give yourself points. And at the end, you add up those points. And what you do then is you can see where you need to work on a few things, or you see where you're doing okay. So the next tab, or the next document in here, is actually the recommendation, so the business safety recommendations. So this is also for you to print out, and you can put your recommendations in here, or you can have us help you. But, you take a look at some of these things. How many of us thought about, having a sick leave policy? How many of you thought about having a visitor policy? I know we're working with employers right now that visitors are still not welcome back. Social distancing, flexibility with policy. So we have a lot of different things. Break rooms, restrooms, or doors. You have workspace dividers. So you can write your recommendations down on here, but we do give you some of the information for you just to, look at in your organization, such as hand sanitizer, disinfecting wipes, how often you clean. We do have a schedule here in our department where in the morning and the afternoon we have scheduled different cleaning for different individuals, and that's really part of our role of us staying healthy as well. So with that, this tool has increased its popularity, especially because we also have it, as you can see, for schools. But one other thing, we want to ask, are your employees feeling like they're safe at work? We do have that Safe at Work employee survey in both English and Spanish, and many employers have used this because some employees would prefer not to say how they're feeling, because if they do, they may risk losing their job, they may risk something bad. I don't know. But, some employees just would rather stay quiet, but you want to hear what they have to say. This is a very safe way to ask them if they're feeling safe in their workplace. So we have this again in English and in Spanish. So please feel free to print this off and check, with your employees. We also have school assessments, pretty much like our business assessment. We do have our experts with our school assistants who are willing to help out as well. So, again, to wrap this up, if somebody is not on mute, again, just a reminder that everybody please mute, because we're going to go to the video very shortly. As Linda checks us off and gets us ready to view the video, I just wanted to again remind you that on the bottom of the screen there's the Ask the Expert, and you can always reach out to us here at Bellin. So the video that we're going to share is one that you're going to find very interesting, and it is going to be sent over. This is recorded, and you'll be able to view this and share this. Please share this with your employees or community members or friends and family. Dr. Burmeister, he is very well ingrained here with Bellin, and sees a lot of different things coming into the emergency room. We've heard a lot of myths, and one wants to know what's true and what's not true. So we asked him if he would help us by creating about a 15-minute presentation from Mythbusters, just kind of talking about the Mythbusters. So I think you're going to find this very educational, very informative. So with that, I'm going to have Linda go ahead and start the video. When that's done, I'll come back and wrap up. In the meantime, I'm going to turn my camera off and let you enjoy the video. Thank you.
Hi, everyone. My name is Linda Gallick. I'm the Health and Wellbeing Consultant at Bellin Health, and I am joined today by Dr. Brad Burmeister, and he's an Emergency Department Physician with Bellin Health. And we're doing this session today because we just really want to bring some additional education and information to you during this presentation. So, Dr. Burmeister, thanks for being here today.
Thanks for having me.
Absolutely. So I really thought it would be fun to maybe do a little myth busting today. I think there's a lot of information floating around about COVID that is probably not true, or maybe there are some threads of truth within some of the things we're hearing. So we can address some of those today. I know that one of the things we're hearing a lot is that COVID is very similar to the flu. Can you speak to that?
Yeah, so there are actually quite a bit of differences between COVID-19 and influenza. One of the probably easiest to understand is COVID-19 is a pandemic. That means that all parts and corners of the world right now are being impacted by it. Whereas influenza often becomes endemic. That means it'll affect certain regions of the country more than others. and not necessarily the whole world all at once. And of course, we also know that influenza is more of a seasonal virus. We see it in the winter and it goes away in the summer. Right now it's the middle of August and we are seeing COVID-19 in our communities. We have a decent number of people hospitalized across our region. And I have not seen a case of influenza since probably March or April. So it's been months since we have seen that. Another important thing is the death rate from COVID-19. We're currently on track of having COVID-19 being one of the top 3 causes of death in the United States this year. I think cancer and heart disease will be the only ones that beat it out. And to date, we've seen, as of early August, about 158,000 people have died of COVID-19 just in the last several months. With influenza, we see it maybe in our worst influenza season last decade, about 50,000 deaths. So we have about 2.5 times the number of people having died of COVID-19 this year than we see in our worst influenza season ever.
Wow. And truly, just to think about that the only other leading causes of death will be cancer and heart disease. I mean, that really puts it into context, the seriousness of this virus.
Right. And actually, the president had just said he thinks that had we have not closed our border with China when we did in January, that we would have really been caught off guard with the virus moving through very quickly through our country. And he thinks there would have been hundreds of thousands of more deaths in the United States had it come to us that quickly.
Wow. So another myth that we're hearing a lot about, there's been so much debate surrounding masking. And we're hearing a lot that people have the thought that maybe masking really won't make a difference in terms of the spread of COVID-19. Can you speak to that?
We like to have a lot of really good, what we call randomized control trials in medicine before we make a decision on what's going to be effective and what's not going to be effective. We don't have a randomized control trial yet for masking with COVID-19. So we really rely on what we call basic science data. That means where we do studies where we have someone wear a mask and we measure how many droplets and how far things spread away from them. We know that whenever we talk, if we yell, if we cough, if we sneeze, you sometimes see this where little droplets will come out from someone's mouth, and sometimes people say, "You spit on me," or they apologize when they're just talking to each other. COVID-19 seems to really travel in droplet form, where those little tiny molecules of essentially or your spit when you talk or you sneeze contains the majority of the virus that comes out from infected people. So we have good basic science data on that right now. And at the same time, we know that masking is very safe. For the far majority of people, they're not going to have any problems wearing a mask under normal circumstances if they're otherwise healthy. In medicine, we always talk about the risks and benefits of things. We see the benefit to likely be very good for helping contain and mitigate COVID-19 in our community. And the risk to, by and large, the majority of people seems to be essentially negligible.
It's really such a simple thing to do, too, isn't it, Dr. Burmeister? I mean, it really, putting on a mask for those short periods of time when we're in a store, we're getting closer to people, it's such an easy thing to do. So then speaking of masks, another thing that we're hearing, and this particularly goes around a lot on social media, and I see people commenting on it, the idea they believe that they're going to get CO2 poisoning from wearing a mask. Can you tell us more about that?
We have not yet seen anyone have a significant impact on the measurement of carbon dioxide in their bloodstream from a mask. There's things that have gone viral on social media where they are measuring the expired concentration of carbon dioxide behind the mask. Everyone has something in them which we call dead space. That's essentially the area between your mouth and your lungs where air stands when you inhale and you exhale, but it never really exchanges. You breathe out all the way and there's still air in your, essentially your throat. It doesn't make it all the way out in exchange. Wearing a mask has a very small increase in that dead space, but it does not have an impact on your personal physiology. Your body is very easily able to compensate for that minimal increase in dead space where we see you measuring that partial pressure of carbon dioxide.
Well, I thought it was a really good thing. A couple weeks ago, I had an ear infection and I had to go to fast care. And they, of course, I had a mask on and they put the pulse ox machine on my finger and I had 100% oxygen, which was just a great real life example that I could see that the mask had no effect on the oxygen that I was getting into my body. So just something that happened to me in particular. So that was interesting. Another thing that we sometimes hear surrounding COVID-19 is that, relatively speaking, the death caused by COVID-19 is relatively small. So what's the big deal and why are we doing all of these things? What do you think about that, Dr. Burmeister?
So again, we saw 158,000 people have died as of August 1st of this year, which is nearly triple our worst influenza season we have had in recent memory. The thing we always need to consider in medicine is not only the mortality, the absolute number of people who have died is a lot, but also we need to consider the morbidity. We've seen patients who come to the hospital with COVID-19. Some have very long hospital stays. They're in the hospital for a significant period of time. And some of them are never able to make it home, or at least haven't yet, where they need to be placed in a nursing home because they have such residual weakness. So if you look at the percentage of people so far who've been infected with COVID-19, the percentage of people who've died from the virus may be small. There's a significantly higher number that have needed to be hospitalized or had a significant impact on their life. So even though that number seems small, when you multiply it by, 306 million people in our country, the current death rate that we have, that's a lot of people.
Mm-hmm. Absolutely. Absolutely. And we also don't know everything about the long-term effects at this point.
Absolutely.
So that's another reason to be careful. So another thing that we seem to be hearing some of course, there's these terms that are being thrown around, and we talk about herd immunity, and some folks are speaking to the idea that, well, let's hurry that along. Let's infect some people and get that herd immunity going. And we're hearing about parties, and people are knowingly having parties trying to spread COVID so that they can try to get to this herd immunity point. What would be your comments on that?
I think this idea of herd immunity probably came from chickenpox. We used to hear 20, 30 years ago, people would get all the kids in the community together, so they all got chickenpox at once. And typically, once you get chickenpox, you have very long-lasting immunity from chickenpox. Last years or almost your entire life, where you do not get chickenpox again if you're exposed to it. The fear with COVID-19 is that if it's like other coronaviruses, most coronaviruses seem to have immunity that maybe lasts 6 months to 1 year. I mean, not all coronaviruses are the same, but if it follows with the other coronaviruses, that would be what we expect. So we don't currently recommend having these coronavirus parties because we don't know how long that immunity is going to last. After having coronavirus, we don't know that you're immune. We don't know how good that immune system is. And you're still putting your community at risk unless you're going to quarantine for 14 days after having a potential exposure with someone. I thankfully have not seen anyone who has partaken in a coronavirus party, or at least they haven't confessed to me in the emergency department that they have. But I have heard from colleagues across the state of Wisconsin that they've had patients come to the emergency department requesting to have a test for COVID-19 done after going and being exposed to someone at a coronavirus party. So we're putting unnecessary burden on our health system if they're going to do that. And second, I actually heard about one case where an individual who attended a party actually brought the virus home to their mom who had asthma. And thankfully she survived, but required hospitalization due to that exposure from her kid, unnecessarily exposing the entire family after going to this party. So that's just an awful idea. There's, again, risks and benefits. There's a lot of risk by doing that to you as a person, the people you're around, your family, and really your entire community. And there's really very low benefit, particularly if immunity only lasts 6 months, like we see with other types of coronavirus. It's really not worth that exposure.
Absolutely. Absolutely. So one last thing that I wanted to talk about today, and certainly here in the state of Wisconsin, we're just trying to take advantage of all the outdoor time that we can get while we have it before the snow flies, right?
Right. It's almost here.
right? Oh, not too quickly, right? But I think that there's a lot of discussion about people feeling just very safe when they're outside, so they feel safe having gatherings outside. What would you say about outside gatherings?
I think it's really important to know that even though it's safer to be outside, it's not absolutely safe. So if you're going to be in close contact with others, there is still a risk of transmission of COVID-19. Back in July, we actually saw a report the CDC had put out about a summer camp in Georgia, and it was a pretty striking report. I don't know if you had heard about it. So essentially, they had staff members who got together for 4 days of training, and then the campers arrived for the first day of camp. All the campers had to have a negative COVID-19 test result within 12 days prior to coming to camp, but the staff didn't. The staff wore masks, the campers did not. And they were mostly in an outdoor setting, although sometimes they were indoors for eating and they stayed in cabins. On the first day of camp, after the campers arrived, one of the staff members developed fever and chills, left the camp the next day. The Department of Health in the state of Georgia quickly got involved after that staff member tested positive for COVID-19, and they essentially evacuated the campers and the staff. They got 300 campers and 100 some staff members home. The state of Georgia then followed those campers and those staff members for 14 days to see how many of them were tested for COVID-19 and how many tested positive. And interestingly enough, they found that 42% of staff and campers became infected with COVID-19, and 3/4 of those staff and campers had symptoms, most commonly headache, fever, and sore throat. We know that the impact on kids seems to be low. They don't get as severe symptoms, but in the study, over 50% of the kids 6 to 10 years old got infected with 19. So even if you try to be outdoors, you're trying to use these recommendations, you have the staff masking. They didn't have the kids in this example. It's still a very high-risk environment and can travel very quickly through a community like that.
This truly speaks to just how contagious this virus really is.
Absolutely.
Well, Dr. Burmeister, we really appreciate you taking the time to do this segment with us. Your information is so invaluable, and we appreciate everything that you do for Bellin and for all the patients that you've been able to treat throughout this time frame. Do you have any parting thoughts for our presentation today?
Yeah, I think right now, the most important thing I want to say is that we are a community and we're all in this together. We know that the decisions that we make impacts our community, and the decision our community makes will impact us and our businesses and our lives. So we really depend on each other to keep moving forward. At Bellin Health, our big saying is that we want to coexist with COVID. We want to do everything that we can to help people have as normal lives as possible, take care of all their other health needs, while also taking care of our community and those impacted by COVID-19. And we do that by taking a lot of modifications to our work. We wear masks, we wear eye shields or eye protection at work. We try to distance ourselves as much as we can, and we do a whole lot of virtual meetings like we're doing right now, which we never really did before. Our CEO, Chris Woloski, ends a lot of her talks with a saying, "Kapsi kapsida," which means we go together. And I think that's just a really important thing to say when we end this meeting here today is "Kapsi kapsida," we go together.
Perfect ending, Dr. Burmeister. Again, thank you so much for your time. For those of you watching the presentation today, thank you for taking the time to watch this presentation. If you have additional questions that you would like answered, you can reach out to us and we'd be happy to answer those for you. You can look at our website, which is bellin.org/employer-COVID. So there's some good resources and information there. You can also email us directly, and that email is going to be employercovid@bellin.org. And again, we'll have our experts get those questions answered for you. So thank you again, Dr. Burmeister. Thank you to our viewers, and hope everybody has a great day.